This is a manual muscle test for the anterior and the middle scalene. We'll start with the arms up, bringing the head up into flexion, which is primarily a motion for the anterior and the middle scalene. Now, if we add a little bit of rotation to the same side, in that position, I'll be testing the anterior and the middle scalene on the right-hand side. My line of drive is going from anterior to posterior. I place my fingers right over yin tong and press. And she's got a little bit of weakness with this one. All right, so then now, let's rotate slightly to the left-hand side. This is now going to be the left-sided scalenes. I'm going this way. You keep me from doing that and hold. Okay, so let's go back into that left-hand side. Let's try that again and hold. And she does definitely have some weakness with that. Now, we could go ahead and treat extra point Jingbi. That would be the motor point innervation for the anterior scalene, and that'll turn the anterior scalene right back on. But using acupuncture as an assessment, because it's associated with the lung sinew channel, we can go ahead and treat lung 7, which I'll go ahead and do right now. All right, so let's find lung 7. We've got lung 8, lung 9, 1.5 sun down from lung 9. Broken sequence is the name. We move over to lung 7. Go ahead and abduct your thumb back and forth for me. I can feel the abductor pollicis longus moving back and forth over the styloid process. I insert the needle directly underneath the abductor pollicis longus and just above that styloid process until she can get a chi sensation, possibly a radiation going in toward Li4. We'll bring the arm back up to comfort. Again, this is part of the assessment to be able to see if lung 7 will strengthen this muscle. Comes up, we rotate, hold that right there. Line of drive, anterior to posterior, and hold. Much stronger. So then we know that in our comprehensive acupuncture treatment protocol, we'll be using lung 7. This is a great test to use for thoracic outlet syndrome. Because the brachial plexus is traveling between the anterior and the middle scalene, that if we continue to do that manual muscle test, you might start to provoke some of the symptoms of thoracic outlet syndrome.